Stop! There is nothing wrong with your device. Do not attempt to adjust your screen. We are controlling the input and output of this program. The hands on the clock are gone, and the hustle and bustle of busyness no longer exists. So take a deep breath and exhale. You are about to cross over into the timeout zone with Dr. Toni, the self-care doctor, for some me time. Here, there is no addiction to hurry, no stress or worry, no strain or pain. Anxiety turns to relaxation, and exhaustion gives in to meditation. Here is where you can just be. Journey weekly with Dr. Toni as she promotes balanced living through information and inspiration while reminding you of your status, that you are a VIP, a very important person in the timeout zone. Remember, take care with self-care. If not you, who? If not now, when?
Hi, I'm Dr. Toni, the self-care doctor with Take Care with Self-Care. Thank you for joining me here in the Timeout Zone, our weekly segment of hot topics. The hands on the clock are gone, and time has stopped so that you can take care of yourself. Today, our hot topic is men's breast cancer, the flip side of the coin. This segment is intended for both men and women, and while it is widely acknowledged that women are affected by this disease more than men, in fact, it is the second highest killer of women behind heart disease. Men's breast cancer is very rarely discussed. So today we're going to talk about it so that we can create an awareness about breast cancer awareness for men, because men are less likely to assume that a lump is breast cancer, which delays them seeking treatment. Therefore, it carries a higher mortality than it does for women. So let's look at breast cancer awareness for men as a self-care tip, with the hopes that women also will share this information with their husbands, their brothers, their sons, their uncles, their friends, and any man that you really care about. First, let's define what breast cancer is. You see, breast cancer is a group of cancer cells called malignant tumor that grows or start in the cells of the breast. Can men develop breast cancer? Absolutely. All people, whether male or female, are born with some breast cells and tissue that can develop into breast cancer. Although breast cancer is rare in men, the American Cancer Society estimates that in 2015 there will be 2,350 new invasive cases of breast cancer for men. And in men, it is usually detected as a hard lump underneath the nipple or the areola. Male breast cancer can exhibit the same symptoms as a woman, including a lump. Anyone who notices anything unusual about their breast should consult a physician immediately. Early detection of breast cancer increases your treatment options and reduces your risk of dying from breast cancer. Men with a genetic predisposition to breast cancer are also at a higher risk of prostate cancer at a younger age than usually diagnosed. Although the treatment outcomes for men and women are similar at the same stage of detection, a man diagnosed with breast cancer should consider seeking the consultation of a gene counselor or a genetic counselor. See, if a man tests positive for the gene BRCA1 or BRCA2, they are a candidate for breast cancer. So you want to make sure that you consult a consultation with a gene counselor to make sure that you know what the genetic traits are for yourself. Also, if diagnosed with breast cancer, you have a 50% chance of passing that gene on to your children. So now that we know that your children can also carry that gene, if you have that predisposition to that gene, we want to talk about the risk factors for developing men's breast cancer. First, the first exposure is to radiation. That is one of the first risk factors for men. The second risk factor for men is having a high level of the hormone estrogen. And then third risk factor for men, and is also the same for women, is just having a family history of breast cancer. So now that you know the risk factors, you should definitely go to your physician, get checked for breast cancer, and so that you can check for those things before you have noticeable symptoms. The doctor will probably ask you questions about your medical history as well as your family medical history. In addition, he will probably, or she will, probably perform a physical examination and perform some imaging tests. Although breast cancer affects women more than men, it is important for men to know their genetic traits that may be in their family history and can be passed on to their children. For more information about men's breast cancer, contact the American Cancer Society at their website at www.cancer.org, or you can contact them at 800-227-2345. If this information has been helpful to you, please let me know by contacting me on my website at www.takecarewithselfcare.com, or follow me on Twitter, like me on my Facebook page, or leave a comment on my YouTube channel. In the meantime, remember, take care with self-care. You are a VIP, a very important person. Take care with self-care. If not you, who? If not now, when? See you next week.